evaluation, no assessment, no teaching, all that kind of stuff, right? Delegate to DCT, there'll be flow questions on there, those should be easy as well. My flow 2 unit, don't give me somebody specialized that needs some special treatment, procedure, teaching, so I'll probably taking that really well for you. Like I said, 8 or so dosage cap questions, the same proportionate number like all of mine that you've been getting. It's the same percentage of questions. 7 or 8 questions per week. Go through your life-threatening arrhythmias, complications, crises, all of that. So each week, pick those out. I got the student, they said, I just don't know where to start studying. If you have a study group, I'm kind of one like, okay, there's going to be 8 questions for week 1, 8 questions for week 2. I'm just going to try to pick out the top 15 points maybe from week 1. And I'm going to see what you come up with for the top 15, and we're going to compare our notes to see if there's, oh yeah, I forgot about that one. What about that one? Or that. If you do make an appointment to meet with a study group with either Mrs. Dowling or me, have a game plan before you come in and meet with us. What do we want to ask about? Because if you say, just tell me everything you know, 60 weeks, I'll be, oh, I don't know where to start. If we flag this, can you explain one more time this, or this part we can remember, or something. So that would be my advice. Otherwise, I'm not going to make very good use of your time if we meet with you and then use my registers to just keep telling us all you need to know. So if you come in with a study group, mark on your notes what it is that you want clarification about, or what it is you want to explain again, or you want to go over again, or whatever it might be. So we make best use of your time. Meeting with study group does not mean Friday night at Buffalo Wild Wings. It means here on campus. We can do some online, which we've done, if you can't come to campus, but it doesn't mean, I study group once that said, we're all getting together Friday night. If we give you good snacks and good drinks, you can just come to our house and get those study groups. I know we can do it. So, anyhow, if you want to do it that way, you can study group, that is perfectly good. Okay, I'm going to go over some exercise questions from today's content. We'll cover that, and then we can kind of cruise through the afternoon a little bit faster than I thought. We were in that early, we can do something new, so whatever. Okay, here's my exercise questions. Probably just lose or error because it's Thanksgiving.
It is very much. Two.
Okay, I have 1 vote for 1. Or a vote, or a conversation about that. Anybody else have another answer you'd like to consider?
2.
2. I heard 4. What does that site look like? Or what is it like? What complications could you have if you have a big blister?
Sunburn looking.
What if you rub the top of that blister off? What could be your complication? That's the
Infection.
There is no contrast beaming from the outside. External radiation, beaming from the outside. There is no contrast. There's no IV necessarily, right? We're just beaming from the outside. So that's how one could have gotten rid of. Picture the site, the skin. It looks like a bad sunburn, like a bad blister, right? We talked about no rubbing on that, nothing but prescribed lotions on that, no sun exposure on that. So if you picture that, or you picture the last time you had a really bad sunburn or a bad blister, if you would rub it off after you towel dry after a shower, what could be your issue? If we expose that to something, the top comes off your blister, you get a risk for infection. Are we okay with that? We don't know if it swells or not. I don't remember anything about that. Probably doesn't really. So 2 probably wouldn't have been something that would have occurred. And there's no reasons it's an external beaming that the patient should be at risk for anaphylaxis. It's not like they're ingesting anything. So that's how you could have gotten a picture of what that site looks like. Anybody have one that you want to pick? Anyone that you want to rule out? You want to pick two. What's the age criteria for limiting visitors?
16.
Nobody under age 16?
Mm-hmm.
Just picture that because I don't know anybody that can't drive coming in here. How about that for a way to remember the age group? The first one, we're talking about precautions. So, her getting around, walking around her room has nothing to do with precautions, right? Nothing to do with safety. If the applicator was placed in there correctly, there shouldn't be worry about her coughing. That doesn't really make much sense either. And the fact that it says, well, one person needs to wear a dosimeter, but nobody else does, that doesn't make any sense either. So visiting precautions, no pregnant visitors, nobody under the age of 16, stay at least 6 feet away from your patient. They bunch your activities, you as the nurse. Don't take linens out till the patient's done being radioactive. Definitely go through that patient education list. Okay, so I vote for 4. Anybody else have a different thought? This is a priority question. So what is the priority question we always have to focus on? Airway, breathing, circulation, and safety. Which one of those is the here and now? You only get to worry about one thing right now because it's a priority question. What does 3 have to do with any of those? Circulation. Priority answers are not things that occur in your future. They're the here and now. You're the nurse, you only get to do one thing. Here and now. So scheduling somebody for therapy tomorrow or in 2 hours or vital signs in 8 hours, none of those count as priority answers. That's not the here and now. So if you stuck with those principles for priority answers, 1 and 2 could have been rolled out in your brain. That's not now, it's later. And if I was debating between 3 and 4, the here and now concern is going to have to be addressing airway, breathing, circulation, and safety. And emesis, worrying about blood, is your circulation part of that. Teaching is seldom a priority answer. Or a patient refusing to wear SCDs, which was an answer on the last test. That's not really your priority concern as her nurse right now. Everybody good with that? If it was a care plan question, it would have been a different story. This was a vital question. Okay, here was what we talked about with staging earlier, kind of process through that a bit, and then we'll go over that. Actually, I think this one was one that was on your quiz assignment. Yeah, it was. Question number 1 on there. Or tell me what that you want to rule out, or how you're going to figure out what's the right answer here. 2. Okay, so there was a vote for 2. Think 2 as well. Anybody else have a
4.
you want to rule out? Okay, number 1 is not correct because that T2 does not mean 2 centimeters. It's a range of sizes. So the T T1 tumor is a smaller size than a T2. There's a scale. A T2 is smaller than a T3, a T3 is smaller than T4. A T2 does not mean 2 centimeters. It means a range of size. So 1 is not correct in that regard. A T2 does not mean 2 tumors. It's a range. If you look in your book, you can see the range. I will score a T1 if the size is this much to this much. So T1 is not correct. It does not mean 2 tumors, so I'm down to 3 and 4. And there's no IS in there to indicate that number 4, right? And N1 means that's not correct either. N1 means there is lymph node involvement. So I'm going to get rid of 4 also. Everybody good on that? The primary tumor I know is some kind of range, so that makes sense to me. If you didn't really know what that range is, you could have ruled the other ones out, what I just did. And there, N1 is there is metastasis to some lymph node involvement. I know that because that N1 is there. And the M0 is no mets. So even if you didn't know number 3 was correct, if you ruled out 1, 2, and 4 as being incorrect, you could have gotten to 3. Does that make sense or no?
Yes.
That was your answer on your quiz assignment as well. Okay. That's not a very good day. What don't you want to do, I guess, would be the question. What do you say you don't want to do?
3.
Not 3? That's a good idea, good decision. I'm sure if it's back in, you hope it works. So we're not going to do 3.
We want to do number 1.
You aren't doing 2. Why are you doing 2?
I would take 4.
Yeah.
She said, what don't you want to do?
We don't want to do, we don't want to do 2 and 3, so now we're down to 1 and 4. They will provide you with a container in the room. You want to contain the radiation since it's now laying on the bed, right? So we're going to contain it and let the container provide for that purpose. And then you can call the healthcare provider. This question was, what initial action do you want to take? I gotta look at the safety piece of this scenario. The safety is I gotta contain this radiation that's laying on the bed, exposing everybody that's here. Thank you for not wanting to put it back in. Four? That should be pretty. Anybody have questions about that? Sure. When would that not be the right answer, right? We don't want to restrict that all word, it's a bad word, right, for your answers. We don't want to restrict all visitors. If you're healthy and well and you could say, remark to your patient, there's no issue there. We know nothing about their fluid intake levels, so that doesn't make sense. And putting in a catheter doesn't make sense either. This is a priority question. It says, what's your first response as the nurse? 4. Circulation, A, B, C's. And then we can deal with the rest of it. I would have put an answer that says scold patient. What are you thinking? I was kidding. I know, as one student said, we can see you rolling your eyes behind your mask when you're in some of those scenarios. Polycythemia.
Red blood cells. Oh, so
Red
then
blood
it-
cells?
Okay, so which of those counts are one direction you decide to use out? Poly means many, everything.
One, oh no.
What's normal red blood cell count?
4.5.
So is that red blood cell count normal or not normal?
Normal.
It's normal.
What?
You have two elevated counts of everything. And is this elevated, is that elevated, is that elevated? Are any 1, 3, or 4 elevated? No. You guys good with that? You'll have an elevated red blood cell count, which will make your hemoglobin which direction? So you read that word polycythemia, understand what that is. Too many blood cells of everything. So I'm gonna write down, before I get to any answers, what those normal levels are. First of all, I thought through the fact that there's gonna be elevated red blood cell count, platelets, and white cells. That's where your brain needs to go. And before I start cruising through the answers, I'm gonna write down or remember what the normals are. So that one, and that one. And that might have gotten you there before you start right away.
So what's a normal hemoglobin count for grams per
What's
milliliter?
normal hemoglobin? Pardon me? 11 to 14.
11 or 14, so.
So that is the only count that's elevated on this whole list.
Oh.
So if you thought through the fact that there's too many blood cells with that disorder, let me think about what normals are for all of those blood cells. I'm looking for the one that's gonna be elevated. And that's how you could have gotten to 2, just by thinking through what's normal for all of those blood cell counts.
I just not familiar with saying it grams over milliliter, like. so
See, and
it's
then
really on-
that's where you sometimes all go astray, because you focus in and hone in on some kind of something like that. But I would not have led you astray by putting some funky value behind that, behind those numbers. Just good with that? So sometimes pause the process, what's the disorder, and what's this answer gonna be about? Before I start pushing in the brain about, oh my gosh, what's this. Just write out the numbers are, especially with hematological disorders. And some of them are 2 less, some are 2 more. So just keep those normals on your paper or in your brain so I can refer to that little chart when I see a disorder like this come up.
Prometheus.
Yeah. So they didn't have the factor to absorb the B12 to begin with, right? And that's what we call pernicious anemia. What causes you to have decreased B12 even if you have the intrinsic factor? What are some other situations? Pardon me? Right. Typically, GI stuff messes with because that's where your B12 gets absorbed in your gastric system. So you see a history of GI issues, Crohn's, a recent GI surgery, intestinal surgery, that may be causing you to have B12 deficiencies. For this patient, by definition, pernicious anemia is that he didn't have the ability to absorb B12 right from the beginning, because that's not how he was taken. Yes. Why didn't you want to do 1? Okay. Why didn't you do 3? And why didn't you just do 4? Can I just save your patient? So that's a good way to think through that. Sometimes these are okay to delegate, but get the context of the scenario. Your patient you're looking, the need for further teaching. You're looking for the wrong answer. You've given me education as your patient, and I'm gonna say, which one of those four, and you'd be like, no, time out, that's not correct.
Four.
Yeah, what happens when you take iron, then you take an iron? Constipation.
I get diarrhea.
So 3, sometimes if you get the context of the question wrong, you might say, yeah, I know that's not iron. I'm looking for the statement that means I need further teaching as your patient. So if you were going to do this in order, what is your priority action? Okay, so you want 3 first. I'll agree with you on that. Anybody have a thought about? How quickly is 4 going to manage his symptoms? Not quickly. So I would probably not put 4 second. You already said you're going to give him oxygen.
I'd say 1.
I'd say 1 next. Oxygen first. He's in severe pain. If we get his pain under control, what might happen with his breathing and the rest of that stuff?
Improve.
It might help us decide that, right? So we're going to go and give him something for pain next, and then what do you want to do?
Hydrate.
3, 1, 2 is what I would do as well. And then what do you want to do with 4 and 5?
5, 4.
5, 4. Because keeping my room temperature at or above 72 is probably not going to change the whole critical state of affairs, right? It's a good idea. It's good patient teaching. Because sickle cell crisis can be triggered by severe room temperature changes. That's a great thing to tell your patient about when he goes home. But he's in severe pain. We got to get him oxygen. You all recognize that. If I decrease your pain, I might be able to get your oxygenation to a better status. Right, so we do that, then I'm going to give you some hydration. We don't know if he needs that necessarily or not, but it's probably a good idea. And then we're going to talk about patient teaching points. Okay, so you're going to have decrease of what counts? Aplastic is a mess up and decrease of all the cells.
So it's going to be.
So you're going to have decrease
5.
red blood cells, so which answer goes with that one?
3.
3. You're going to have decreased white blood cells. What goes with that one? And you're going to have decreased platelets.
5.
There you go. So some of you all said, I just want to pick them all, but I want to know that you know exactly what blood cells are affected by that anemia. Breaking that word down is absence of, anemia is absence of all those white. Yes, he may have pain, we don't know. That doesn't necessarily go with that. He may have nausea, we don't know about that. What absolutely goes with that type of anemia are those 3 low. If you answer this question correctly, that tells me you know what aplastic anemia is, you know what blood cells are going to be decreased, and you know what's going to be the result of those 3 blood cells that are decreased. Versus just picking, I think all of it might apply. How do you know that the patient's having pain or nausea? That's where I would have asked myself. So you don't get on some place where you don't want to go and answering it correctly.
That's cute.
So I will go over the quiz assignments because I heard Another answer choice was there is involvement of the lymph nodes. Is that true or not true? She was given a score of N1.
Yeah.
Yep. And she was given a score of T2. So the nurse said, you have a primary tumor. Correct or not correct, by giving you a T2 score? That means there is a tumor present, because I've already figured out the size of it. That was the right answer. Your other answer choice was, there is lymph node involvement, which there was. And it says, and distant metastasis cannot be assessed. What goes with an M if I can't assess it? M, X. M0 means none. So if there was an MX in that staging score, you would have said it can't be assessed. And M0 means it is not present. The difference between X and 0.
But if it,
Correct. X means I can't assess it because of the way, like they'll stage leukemias and that, and they'll put some X's that they can't assess some elements of that.
so if it's in the breast and it's in a lymph node near the breast, that's not considered an M1?
That would have been some kind of score that went with your N, because N is lymph node involvement. N is
So the M is other organs then, okay.
good question. And the other answer choice was you have two tumors, which you already said was not right. Each means you have a tumor is a certain size range. Okay, that was question 1. Question 2 is your patient's having brachytherapy. Brachy means where is the is he radioactive? Yes, inside of him, her. Brachytherapy means she is radioactive. Which safety precautions would the nurse implement? Your choice 1 was ensure the visitors maintain a 3 feet distance from the radiation source. That's wrong. Why is that wrong?
6 feet.
6 feet, okay. Prohibit all pregnant visitors.
Yes.
Yes. This is a time when you can pick all. C is assign the patient to a private room.
Yes.
That makes sense. I wouldn't want to expose you to anybody else. D is limit visits to 30 minutes a day.
Wrong.
Yes, that was part of the,
Oh, yeah.
but you have to make sure they're not
The
pregnant or
child
not
is
under
the one
16.
I got wrong. I
Right,
put the
so,
child.
we want to restrict all visitors, we don't want any more surgery to you than necessary for our patient. Guide patient contact with staff by principles of time, distance, and shielding.
Yes,
Yes, that makes sense.
yes.
No more time necessary than by the patient to exposure to you to more radiation, stay away from 6 feet, and use a shielding device, either apron or shield. That makes sense. Your other answer choice next is ensure that staff members wear dosimeters to prevent exposure to radiation.
Yes.
Do they prevent exposure?
No.
God.
So is it fees?
Ah, so you were trying to trick
You were
us.
trying to trick
No, I'm just
And
kidding.
is limit visits by children to 15 minutes a day.
No,
No,
it should be
they
no
shouldn't
children.
be there at all.
Thank you.
I picked that one. Don't.
Okay. The nurse prepares to administer the prescribed chemotherapy agent. This patient has ovarian cancer. Identify the patient is at increased risk of cardiac toxicity based on which risk factor? Choice 1, hypertension.
Yes.
Yes, that makes sense, right?
Yeah.
B is female.
Yes.
Yep, she's female. Kidney failure. Want that one or not?
Yes.
You think that makes her a risk factor for cardiac toxicity?
Yeah.
Yes.
Her
Correct.
electrolytes are gonna be messed up.
Ethnicity, she's Caucasian.
No.
No. And your other choice was drug use, and she said she smokes, uses marijuana occasionally.
Yeah.
No.
No, we don't really have enough information to know how often occasionally is. And her age, she's 51.
No.
What did he say?
He said, yeah, that 51 first, somebody 51 would be.
I will smack
Age
him
is
now.
always,
And she said, if you pick
Almost always
anything, she always
65.
says, if you pick anything,
she's 51.
Fifty-five.
Female. Minutes of our class together.
Yes.
Smoking is always the answer. No.
It's always a
So it don't
problem.
matter.
It's more than that to create a risk factor. You shouldn't be smoking anyways, but by definition, I think it's, yeah, 3 packs a day or something.
Oh, so it's something.
And
You said
meningitis.
she said
No.
Is there a correlation between that and you getting cardiac toxicity?
No.
Because where's meningitis located?
Meninges.
Okay, question 4. The nurse provides post-op care following the patient's BSO, which is what? A bilateral
Something that starts with an S.
salpingo.
Ooh,
Which
rectomy.
is the removal of what body parts?
The
Ovaries are gone.
And fallopian tubes is the S. You'd monitor for what complication? A, food and electrolyte imbalance.
So I thought that virus.
Sure.
It is?
Yeah. You're taking care of a post-op patient. I would probably almost always take that as a concern, right? Because we're moving fluids in during surgery. We expect your kidneys to start working following surgery. If I were going to do an educated guess, I would always probably pick that as being a post-op concern or something that I'm going to watch out for. Just by the nature of the way that works. Organ dysfunction. You want to pick that one or you don't want to pick that one?
Not really.
So like the
Organ dysfunction, I would also on that, we expect all of those things to go back into play. Bleeding, you all said that, right?
Yep.
It's vascular. Wound dehiscence, always a concern, right?
Yeah, I don't know
Actually,
that.
Incision of any type.
I have a question on that.
Your question is what?
Isn't that a laparoscopic procedure, like, most of the time?
You made an assumption there.
See, but like it is though, right? Isn't it? Isn't that like
It
more?
can be, it isn't necessarily always the case, and you will know that from here. You made an assumption.
I don't know.
So, did she say no to this?
Don't go there, actually. Wow. Thought you were setting us up. Myelofibrosis. Anybody gonna watch out for that post-op
Yeah.
complication?
Yeah.
Of course, always.
Messed up.
All right. Next
That was
question.
all the answers?
I provided information for a new graduate, so always blame new graduates, right? About the prescribed chemotherapy agent. The educator identifies at which statement made by the nurse indicates understanding of the teaching. And the patient's been prescribed doxorubicin once on the first day of a 21-day cycle. Okay. The new graduate says, A, I cannot give chemotherapy until I've had at least 5 years of oncological experience. Anybody want to pick that one? No, there's no criteria like that, right? And the next time the nurse says, the new graduate says, the medication should not be given in a vein, in the hand, or wrist.
That one.
That was the statement that made you understanding of the teaching. Because where should you give that high dose chemo
Larger vein.
medication?
Not the hand,
Not the hand or the wrist. Because typically what sizes are your,
small.
Too little.
correct, and we don't want to, we want to prevent, what's that complication?
Infiltration.
Stratisation, correct. Infiltration. But you're right, you want to prevent infiltration. Because if you have a chemo that infiltrates, you're going right there. Chemo that infiltrates, where's it gonna go? Outside the vein, into surrounding tissue. And extravasation is what?
Necrosis of the tissue.
Yeah, eating of tissue, exactly. So you are all right there. The next answer choice was, the medication could cause a localized inflammatory response, but does not usually cause permanent tissue damage.
That's not true.
No, yeah, that doesn't make you understand it, because we're talking about chemo. And D, with this type of chemo, extravasation cannot be prevented, but an antidote can be given to limit tissue damage.
That's not true either.
True or false, extravasation can be prevented.
Yes.
Correct. And don't mix that with infiltration.
So,
It may
but-
infiltrate, but hope if you're monitoring close enough, it's not gonna start eating away the tissue around it, causing extravasation.
So is B the correct answer?
The correct answer was, I shouldn't give it in the hand or wrist.
Okay, thank you.
You want this nice big vein or central line when you're giving chemo, or intake, or whatever else. When reviewing the patient's lab results following the chemo treatment, the nurse expects which finding? A, white count greater than 4,000. doxorubicin for ovarian cancer. Which way do you think the white count?
No.
Correct. Right, probably be low. So you don't expect a white count to be high. Lowest blood count, 21 to 28 days after chemo is given.
Not 7 to
Lowest
14.
blood counts occurring in 21 to 28 days after chemo is given.
No.
Okay, so what's the lowest count for your red blood cells?
2 to 3 months.
White count.
7 to 14 days.
14 days, platelets. Okay, correct. Keep track of those. Know what implications all three of those counts have, and how you're going to educate your patient accordingly. And don't tell your patient to stay away from everything that my policy is doing your policy. The next answer choice was myelosuppression. The next answer choice, thrombocythemia. What is cythemia, thrombocythemia? Too many or too many? Too many. Would you have too many platelets following your chemo? Which direction they usually send all your blood counts?
Down.
So are you gonna have thrombocythemia or not?
No.
And red blood cells less than 4.2 million. Which way will your red blood cells go?
Down.
Down.
What's normal red blood cell count?
45. 4.5.
5.4.
Okay, so are you expecting a lowered red blood cell count?
Not immediately.
I thought you said there's too many.
What?
I thought you said there's too many.
No, we're talking about something that just had chemo.
Yeah, so it would
We're not talking about polycythemia. Break the word down, keep the context and situation going, so you're saying right there. Okay, the nurse would intervene after observing another healthcare provider performing which treatment when managing the patient's mucositis. So you're looking for what? You're going to intervene the wrong action. So one answer choice was use normal saline mouth rinses every 2 hours.
That
Are you going to intervene by doing that for your patient?
needs to be
Are you going to remove
refrigerated.
injectors except for meals? Are you going to intervene if I do that? Because you want to do that, okay, mucositis, you don't want the dentures in any more than necessary, irritating. So that's cool if I do that for your patient. Applies water soluble lip lubricant. You want to intervene if I do that? No. I'm gonna also gently floss the teeth after every meal.
No.
Isn't that good dental hygiene? Why can't I do that for your patient?
Bleeding
Your patient didn't make
gums.
a bleed.
Okay. When determining healthcare team assignments, the nursing team leader notes the patient's morning lab results and would assign which nurse to the patient. Their red blood cells are 2 million. Their white count is 50. Their ANC is 300. Their platelets are 75,000. So which direction is their ANC count? Good or bad? 300. What is yours supposed to be? Correct. So is your ANC count low or high? Low. And their white count is 50. Okay. So if they have a low neutrophil count, what kind of precautions should I put them into?
Isolation.
Neutropenic precautions, right? And you're protecting the patient
Patient.
from you. My germs.
Infection.
So here are your nurse choices. I'm trying to figure out if I'm coming in and you're going to give me an assignment to a patient, given this patient, who you're going to give this patient to, what nurse? Your choice is A nurse who received an MMR vaccine 1 day ago.
No.
Why not?
That's a live vaccine.
A live vaccine, yep. The next choice is a nurse who received a pneumococcal vaccine 2 days ago.
Sure.
You're going to give that. What is your hesitation or what is your decision on that?
Sure. I can do it.
It's not a live virus.
Is pneumococcal vaccine a live virus or not? No, it is not. So if I had a pneumococcal vaccine 2 days ago, should I take care of this patient or not?
Sure. Yeah.
Yes, no harm, right?
Right.
It's not a live virus. The next nurse choice is a nurse who states, I'm pretty sure that my head congestion is related to allergies.
That's me.
She
Why
might be
aren't you
sick.
giving that?
She might be sick.
You could have a head cold coming on or something else. We can't assume that. We don't want you taking a chance of taking care of this patient. And your next choice says, a nurse reports, I get very claustrophobic when
Thanks for doing that.
If you're picking people, ideal people, if I tell you that, what's